Welcome to Muscle Fix Mobile Podcast. This is episode 5, featuring Christine Lake, health and wellness counselor and helper of those with various substance abuse and PTSD issues, as well as Dr. Vincent Tafuri, chiropractor and general knower of many things. So that said, please tell us about your process. Like what got you into this? So how'd you get started? What are you doing?
So I definitely didn't go into it thinking I was going to be doing it for anybody else other than myself. I basically woke up on my 39th birthday and I basically was having a panic attack. My husband at the time, we're now divorced. We had a business together and I just had such anxiety about all the pressures of, being a working mom with 2 babies and, running the business and everything. And so I was having all this anxiety and I said, I just can't live with this anymore. And I remember I kept seeing this modality called EFT, Emotional Freedom Technique, in a newsletter by Dr. Mercola. He's a kind of well-known chiropractor who's got a huge website, mercola.com. And I just kept seeing this EFT stuff. And so I said, you know what, I'm gonna give this a try and I'll do it every day for 30 days straight. And if I see any change, I'll just keep going with it. And that was 10 years ago. And as soon as I dove in, I just started sharing with other people and teaching other people and doing sessions with people because it was so transformational for me. Yeah. So that's how the energy piece started.
Okay. So in your experience, how did you, refine your process or change over those 10 years as you started seeing clients and dealing with people's issues?
Well, it's kind of interesting because with EFT, they kind of tell you out of the gate that after a certain period of time, you actually don't even need to tap anymore. You've basically entrained your body to, when you just start certain phrases, it will start releasing. So I started being able to, not have to tap. And then I was able to do distance healing for people. And then, I myself have been on a holistic spiritual journey for 20 years. And so just being, a consumer of so many other products, my process eventually kind of morphed into it. And so, what I try to do when I work with someone is to we isolate exactly where the energy is stuck in the body. And I take them through a series of questions like, where is it? What shape is it? What color is it? What texture is it? What emotions are stuck in there? And when you do that kind of process, it keeps people out of their story, right? So it's our story that keeps us stuck. It keeps us traumatized because we make up these ridiculous stories about why something might have happened. And with that process, there is no story. It's really you're just really connecting with the energy in your body, trying to identify that specific event, where it's stuck. Is it in your chest? Is it in your stomach? Is it in your head? Is it in your throat? And then really having them, you're really just trying to activate that wound so that it brings it to the surface. You can focus on it for a few moments and then it can be released, because every emotion you've ever had wants to be fully acknowledged and felt and realized, right? So what happens is you can have something upsetting and happen, but the emotion gets shut down and it never reaches the place of completion where it's gone through the whole cycle and then it's dissipated. They usually get clamped down and they get stopped, and then they get shoved down into a box somewhere in your body and you try to push out the memory. But it's always there, and it's always kind of just under the surface, and it's sucking your energy. It's drawing your energy to it and kind of lowering your frequency. And with every wound you release, you find you get lighter and lighter and lighter.
So what about someone who's physiologically addicted to, say, like heroin or something? Can this process help them, or how does it, or how can you get them off of something that is so deeply stuck in their system, if that's possible?
So I think you have to really kind of look at the whole picture of things, right? So there's going to be a chemical addiction, which the body has come into, become addicted to. But, the reason someone turns to any kind of vice, whether it's drugs, sex, gambling, overwork, whatever, is really just people are running from their pain, right? I mean, that's why we seek vices, to distract us from our pain. People don't like being still and silent, because when you actually stop and you get still, your wounds rise to the surface and they start, you start to feel anxious, and then that's when you go run to go find something to distract you from it so you don't have to face it. So one, you'd have to address like the chemical stuff, which you might, I'm sure Dr. T would be able to, help you with that as well in terms of like nutritionally. You'd want to alkalize the body if they're trying to get off a chemical addiction. So that'll help to neutralize some of the, the withdrawal symptoms. But you don't, absolutely, if you're going to get off any kind of addiction and not address your emotional wounds, that's not really a long-term good plan. Because willpower, because you'll just switch addictions. You'll just go from heroin to gambling, or from overeating to overworking.
Very interesting concept and very true. Are we not all trying to fill a hole, I suppose? So that's certainly a thought. So Dr. T, from your point of view, as Christine alluded to, what do you think could be done for some of these individuals, from a medical basis, from your point of view?
I mean, first and foremost, you're talking to a very amazing woman. I've known Christine now for about 20 years, and she just keeps evolving to something that surprises me all the time. In fact, we recently made another connection again, and because of her other passions, like especially her way to express herself with artwork, I saw something that she had posted on Facebook, and it just really captivated me a lot, so much for the point I said, do you have a print of this thing? I want to buy it from you. So I'm one of 500. I think I'm the first person who bought a print from her.
You got the first print of that painting.
And it's in my office, and people see it all the time. And I give them your information. So this
awesome. Thank you. I appreciate that.
Yeah. But, not to get into anything too specific about the aspect of heroin addiction, I agree 100%. So here's the caveat to everything. When you have a substance abuse problem, let's talk about what's happened in this country. Over many, many decades, we have basically become a society who more or less in this country fix problems with pills. Right. And one of the rampant situation and being acknowledged, especially by the medical world now, is that they created a problem. The problem was that they basically try to, fix everything from a pharmaceutical basis. And what you're talking about, especially all these emotional imbalances, and that quiet time, how basically everybody tries to keep busy. I mean, it's pretty incredible when you think about it, that every addiction deals from a source of pain. So the reality is that when we get somebody, let's say, in my own building, believe it or not, right now, the medical building I'm in, a facility just opened up that does outpatient addiction to both opiates and alcohol, because especially now, with everything that's going on with COVID, the numbers have become astronomical. Prior to this time, let's specifically look at the opiate issue. For many, many years, my background being very diverse, traditionally trained as a chiropractor and being somewhat of a holistic physician in many, many different areas, and most chiropractors are and evolve to that more and more. Many years ago, I did a lot of work in the realm of personal injury, and I had to deal with practitioners of all different backgrounds. And one of them I became quite friendly with was a pain management specialist. And he was very much in tune with what was happening really 18 years ago, what was going on in the environment. And he said, the sword of Damocles is coming down. The reality is that there's been overt prescription, not so much by our particular area, meaning the pain management specialist, because we've learned the bittersweet aspect of this thing. Yes, we can help people with pain. And the people that we will overtly, sometimes utilize this medication are the people with cancer and things of that nature, are usually just trying to control the level of their problem. In many situations, they're more in hospice situations that, there's really no cure at this particular point. But he said the rampant overprescription from the general medical practitioner, whether it be an internist, a general practitioner, and even sometimes the orthopedic surgeon, has led to this cataclysmic problem. And, as I looked at this and researched it, and we looked at different things in many of the pharmaceutical industries, and there's blatant information how they told practitioners who are basically, working in the realm of medicine and looking for answers to help people, do not neglect the pain issues associated with these patients. Give them as much as they need to control their pain. And that has gotten us to where we are. And the bigger problem has been that all these different people, from back sprains to new and post-surgical conditions, so on and so forth, many of these people were consuming the medication. We know that there is a high rate of addiction, especially with opiate substance. I think the statistic, believe it or not, is like 1 in 8. So that if a person is taking a medication for the controlling aspect of pain, And we've seen all different walks and talks of life. You know, we think about, oh my God, the heroin abuser or something of that nature was a person whose life was kind of tumultuous, fell apart, or partied too much or something like that. Doctors, lawyers, blue collar people, teachers, and children, especially young adolescents, where their parents left the pharmaceuticals and the cabinet, and the kids get together and they party and they start doing things, and the drugs, you know, are freely available, unknowing till many of the times that the parents that these things were still there. Like, how many people typically are prescribed? Even look at the aspect of an antibiotic. They take the antibiotic, maybe they don't use all of it, some of it's left there, and they stick it in the closet, and it's sitting there for 3 years. Well, there's issues associated with antibiotics, but the bigger problem is when you're dealing with Vicodin, Oxycontin, Oxycodone, Percocet, which was handed out like candy. I mean, I had a multi-specialty practice for 13 years. And one of the things that we all came into close agreement with, because we came from a holistic perspective, is that we're not going to prescribe medications that are a narcotic opiate-based substance. And people would sometimes, just because they knew we treated pain, and they would just show up, and, you know, when we found out what it was, we tried to direct them in the right direction. I said, look, what this gentleman told me very succinctly back in the day before it was noticed is the only way a person's really going to get off a chemical dependency is to really go into a true detox situation, you know, in these private facilities, where most of them were in hospitals, and they're very expensive. I mean, you're talking $30,000 typically for a 28-day period. A lot of times insurance doesn't cover it, so on and so forth. But the nail on the head is exactly what you talked about. If you don't look at the other, what created the issue associated with this person?
What are you running from?
What are you running from? Yeah.
What are you running from?
And that's a huge factor.
And, you know, emotional pain is just simply a symptom that you're off course. You're not in alignment. You're living some part of your life out of alignment with who you truly are. And that's why you're stuck, unhappy, frustrated, whatever, you know?
Yeah.
And a pill isn't going to fix that.
No, it's not. You got to really get the core. I mean, it really takes a team of people to get together to work and help these people, inclusive of the proper nutritional therapy, switching their body chemistry, adjusting their spine to correct the neuroemotional balances as well, working with things and counselors and coaches and things of that nature to try and bring them into a better perspective of seeing what's going on, not just detoxifying them from that, because the rate of what they call recidivism is incredibly high. And I've seen that, unfortunately, even with some family members, nieces and things of that nature, that it took 3 times to get through. And thank God today, now she's a young mom, and she's turned her life around incredibly because of that situation. So, you know, there's just a lot involved with this. There's no simple answer to it. But, you know, specifically, there's a lot of people in pain. And aside from the issue of opiate addiction and what have you, it's real. I'm very proactive like you are. If I see that there's smoke, what do they say? There's fire. So when I tell people right now, from a perspective I do, when they come in, I say, look, I treat people on an equilateral triangle. There's structure and function, there's biochemistry and toxicity, and there's emotion and stress. And when one goes out of balance, it throws the other off too. So you have to address all of it. And comes down to it. And that's how we have a lot. And it's like, you know, the commercial, I will say that always cracks me up, but it makes a lot of sense. They have a person saying, well, if I eat 1 stalk of broccoli, a cruciferous vegetable, I'll never get cancer. If I do 1 push-up, I'll never get heart disease. Life is balance, right? Remember that term, that company that we used to know very well? Life is balance, right? It truly is. And as you get older, you know, I always say we learn a lot along the way. It's called knowledge, but life teaches us wisdom. One way or the other, you know, and that's a huge factor.
But you know what? I also think that there's a lot of ancient wisdom that we have forgotten about. Like just the simple act of like praying before you eat. You know, it was really interesting. I was, when I lived back in New York, I was going to a healer for a session on something. And there was a Dunkin' Donuts right by our house. And I'll be honest with you, I know all this stuff. I know all about, you know, white refined sugar. I know all about like the pesticides on coffee or whatever. And I was medium, light, and sweet, right? And I'm absolutely certain there's all
being a human being, and we all, you know, nobody, you know, completely perfect, right?
But I said, let me try something. And so I bought the medium, light, and sweet. And then I prayed to God and asked him to bless the coffee and make sure, infuse it with the highest vibration to nourish my body. And then I went inside and I said, can you muscle test me? And she muscle tested me and she said, there's nothing in here that'll hurt you. Drink as much as you want.
Interesting stuff.
Yeah, yeah. You got to understand, Christine has gone down a long road in many different avenues and learned many different things, many of which I've been exposed to as well. And that's the reason why we can communicate and converse. The average person is going to listen and say, what is muscle test?
What is she talking about?
Talking about? What's EFT? What's tapping? So I'd like you to demonstrate to Greg, because I've been exposed to it, through many years as well. And
Sure.
I don't typically integrate it in, but I've done it with some neuroemotional technique,
Sure.
especially when we're helping people deal with that concept, even with weight loss, talking about different, because the scars are deep and they're real,
Right. Right. Yeah. So Greg, in terms of EFT, so EFT was started by Gary Craig. He was a Stanford engineer who was fascinated with both Chinese medicine and psychology. And so what he did was he thought about, acupuncture, the ancient art of acupuncture. And what if you could just tap on the meridian points? So if you tap on certain parts of the body, your hand and different meridian points. And what you're doing when you're doing it, you're stimulating those points. And then the crown chakra, right? You're stimulating those points, which would normally be stimulated with acupuncture. And you're thinking about emotionally upsetting experience that you want to bring to the surface. And then through that tapping technique, you make phrases like, even though I'm so upset that I, lost my job or my boyfriend broke up, whatever it is, whatever your wound is, right? Even though I'm so upset about this, I deeply and completely love and accept myself. And it's all about activating that wound in your body so that it gets triggered. And then when you're tapping and making the phrases, you're allowing the energy to dissipate and leave the body while reprogramming a new thought into the body. Does that make sense?
Yeah, absolutely. It's interesting. What led me to working with Dr. T was actually working with a colleague of his, Dr. Nick Kuzmanovsky. And interestingly enough, that's how we got started, was using, I guess, ancient or otherwise forgotten modalities, in his case, cupping, something that's been around for several thousands of years. And completely,
I've done everything.
So completely forgotten by Western medicine or ignored, very developed, but in the Soviet Union and in China, and very heavily documented. But that's the whole point, is to bring it to the Western masses. So interesting.
No, I was just going to say, it's really funny that when people say, a lot of the modalities that, Dr. T uses or other people use, healers, they'll say it's new age. And the funny thing is, some of these things are thousands of years old. They're the furthest thing from new.
Well, it's also like the terminology alternative. I look at it this way, and then if we go to the true essence of Asian medicine, the Oriental physician, as it was termed back in the day, the physician was paid by the people to keep them healthy. When the patient got sick, the doctor didn't get paid. So realistically, we've really thrown down, and once again, it's just the programming of this country. I mean, where else do you sit down at night, to watch some TV, and you're bombarded by a little chameleon who talks about insurance, telephone, pharmaceutical companies passing drugs with 14,000 side effects that people don't even hear anymore, and then eating, pizza and Southern fried chicken, and this is the staple of their life. And how much more is it personified during a time of crisis and stress, when we know that the adrenal glands, which are a primary functional modality of our body's body chemistry, are being stressed to the point that it creates a cataclysmic reaction with all the endocrine functions of our body, leading to the craving factor of refined carbohydrates, sugar. So people eat sugar and they wind up feeling good, and then it spikes their insulin response and it drops their blood sugar. So what do they want? They want more sugar. So the bottom line is this vicious cycle, and it's like that whether it be with drugs or alcohol, tobacco, whatever it might be. So and gluttony and eating bad dietary things and things of that nature. But it gets back to exactly what you started with: pain. Dealing with the issue, the emotional issue associated with that. And, that's a big acknowledgement when trying to get to a better place in life, is trying to deal with that. And having a person like yourself as a practitioner who can help guide people in that direction is a godsend in many ways, because most of these people have tried so many different things, whether it's the psychopharmaceuticals, long-term counseling, cognitive therapy, and there are different therapeutic approaches. As you know, my wife Karen's a clinical social worker, and she's done counseling too. And you have to match the right type of therapeutic approach to the right problem. One size does not fit all. Just
Right.
like as when I see a patient as a chiropractor, like I don't adjust everybody the same way. I don't
Right.
adjust an infant the way I adjust, a bodybuilder. It's just a
Right.
whole different situation.
And I think that's what I honor. So, there's so many reasons I have so much respect and honor for, holistic, alternative, new age, whatever you want to call it, medicine. For several reasons. One, I personally don't believe, and I've never bought into the drug it and cut it concept. Like 16 years ago, I had precancerous cells, and my doctor, had done like 2 freezings and, cuttings or whatever. And then he came back for a third time. And I said, tell me what your solution is to make sure I don't end up dead of cervical cancer. And he said, well, we'll just keep doing this. We'll just keep doing the freezings or the cuttings until we eventually give you a hysterectomy. I said, thank you very much. I hung up the phone and I never went back to him. And I flew to Hippocrates Institute in Florida, went through their 3-week life change program to educate myself about my body. Because I don't think cutting out an entire system of my body is an intelligent strategy long-term to have good health. Like every body part is there for a reason. But if people use the same common sense they did with their car for their body, it would be totally different. If you took your car to your mechanic and he said, we're going to take out your transmission and we're not going to put a new one in and you'll just deal without it, you'd never go back.
It doesn't work, right?
Well, fascinating. So what did you change, or what did you learn that kept you
I learned about
cancer-free?
nutritional healing. I healed emotional stuff. And it was fascinating because they did this live blood analysis there where they would prick your finger and then you do 3 dabs of blood. And every dab was 7 years back. So it was 7, 14, what is that, 21?
21,
No?
yeah, 28.
Yeah. And so they looked at my blood and they're like, 14 years ago, you had a very traumatic experience with a female woman in your family and they could see it in my blood. And the cool thing is, right, so that same thing will be in my kids' blood. But when I heal it from me and my children. I mean, it's amazing,
Wow,
the impact.
yeah.
Exactly.
Pretty
Totally.
crazy. Yeah.
Interesting.
It's amazing.
Yeah.
So what's one of your more interesting cases, without giving personal details, that I guess really challenged you, or you found was a real process to get them through whatever they were getting through?
I don't know that I remember any specific challenging ones. I've worked with people who've had sexual assault, had someone I worked with who'd been in the pogroms, in Russia, just all different cases, and in the moment, to be honest, I feel like, I'm so present. It's almost like, when you're connected with someone, and I'm an empath. So when I'm connected to their energy, I'm literally feeling exactly what they're feeling. And my body literally like pulls it out of them. And then I have to do like energy clearings to kind of clear my energy so I don't retain any of that. But really, like when I hang up, I don't even remember what I've done because I've been so present. It's like, when you've been in those conversations and you're just kind of like flowing and they're like, what'd you say? You're like, I don't even know. Like, I don't know. What did I just say? I was just in the moment. There's nothing scripted. And I never have a script with anybody. I always just sit down with a blank piece of paper. And in that moment, I'm always kind of guided where we're going to go. Mm-hmm. And no two are ever the same, just like you in terms of adjusting someone. Right. It's never going to be exactly the same because, like the session we did on that test with you was totally different than I've done with anyone.
Definitely. So, and quite frankly, what I was looking for initially led me down a different road and something I needed to work on within, my own relationship with my spouse. And it was a really powerful thing. So, I mean, it's pretty amazing when you start to think about all these different factors and how, unfortunately, not enough people are exposed to this type of therapeutic, process. And it's something that it's not invasive. It's very healthy. And you basically know when you're dealing with somebody who you can't help, you can make the appropriate recommendation. Say, look, we're trying here, but I do think that maybe you need something, you may need to go to the emergency room right now because you're having a psychotic break or something of that nature. But if people can we're looking for the people, or you're looking for the people that you can make a difference in their life, because there's so many people challenged right now on a day-to-day basis. I mean, right now you should have a COVID special going on. It's like, I mean, I'm sure your phone would be ringing off the hook because people just don't realize that there are many ways of trying to heal the pain and get to the source of the problem to deal with the issue. And that's just what I do, even as a holistic practitioner. I say, look, you can continue doing the same thing, and you're taking a variety of medications for the treatment of your type 2 diabetes. But the reality is that you're having some major challenges in your lifestyle, your diet, the way you do things, what's going on, your stress levels. And we integrate a whole comprehensive approach to dealing with it. And I would say, honestly, without failure, 99% of the time, that's how powerful it is, that their life improves so significantly that their physicians of medicine, who are the ones that prescribe the medication, either reduce it or eliminate it. And it's happened with a multitude of different conditions, autoimmune problems, so on and so forth. So, we're not making any grandiose claims. We're just helping people. That's it. Treating, it's a treatment of the body, not necessarily to the body, because you're working from more of an innate intelligence, that life source that's with being. I say, okay, you don't believe that there's an innate intelligence? Okay, cut your finger, and if you're healthy enough, watch it heal, and there you'll get a scab and everything else will stop. Well, try and do that on a corpse where the innate intelligence is no longer possible anymore, and see what happens. There's not going to be any healing. In fact, it's always interesting when you watch these forensic shows. They could tell based upon the pathology of the situation, if the person was, had a wound, a mortal wound, or it was where they shot after, like the person they killed, and then they were shot. It's like this person, because of everything that's going on, the shot was delivered afterwards to make it look like something else.
Right, and they can tell. But haven't you found that there's a certain profile of person that does self-development work and alternative, and they tend to be like there's overlapping. Like people that do self-development tend to be very much into alternative, holistic things like that. It's kind of interesting that way.
The population is growing because people are a little bit. Let's put it this way. My brethren in medicine, I give them a lot of kudos and say, if you fracture something, you rip something off, you're in the midst of a cardiac arrest because you've not been able to take care, you've neglected the things that gotten to this point, then procedures that they utilize are life-saving. And by all means, you should do it. We're not saying that person should do that. But when it comes down to the health aspect of it, they need to integrate in some of the things that we're talking about and find the appropriate practitioner that they can work with, not this in and out 15-second type of thing. Or now we have telemedicine where instead of the physician seeing 50 people a day, now they can do 75 to 100 people a day and just say, okay, now you need this drug, and it goes right there and the drug gets sent to them. Healing is an internal process at various levels and must be addressed and dealt with if people really want it. And I think more people are looking for it. Unfortunately, still, like much of the things we know now, it's very easy to get brainwashed in the opposite direction. It's propaganda.
Well, but it's very frustrating, the whole Western track, because so I was sick for a very long time. I had constant issues, autoimmune issues, and thousands over years I would spend trying to figure out what was going on. And then I finally did a hair mineral analysis, and I found out I had uranium poisoning.
A lot of people have metal toxicity, and it's one of the most accurate things. I mean, there's a lot of stuff that goes around with hair, a toxicity analysis. And if it's not done with the right company, not collected the right way, so on and so forth, it's a little bit fictitious, but it does have the basis of very valuable information. And because we live in such a polluted world, many of us already are suffering with metal toxicity. And it's a perfect venue, as you know, for parasites. The parasites, the bugs love, everything. Metals. They eat it up,
But what was horrible was, I spent all the hundreds of dollars to get the hair mineral analysis test. I was working with a naturopath, and I was taking 27 pills a day to detox. And I had an Excel spreadsheet of all the nutrition I was taking to, to deal with all that. And I took it to the VA because I got uranium poisoning in the Gulf War when I was over in Saudi Arabia, and they were burning depleted uranium, right?
Amazing.
So I take it to the VA. I've got my Excel spreadsheet. I've got my test results, my hair mineral analysis with all the different heavy metals, because I had arsenic and I had other stuff. And I'm like, do you want to see this? And she said, no. I said, well, do you want to see the Excel spreadsheet of all the nutrition, the supplements I'm taking to try to detox the heavy metals? No. I was like, I'm done with her. I'm done. Yeah. Why would I go back?
So here's the problem. I've been doing now this incredible weight loss program now for the last 6-7 years with patients. And I've had probably close to 100 medical physicians as my patients.
Wow.
And the reality is, and I've got to know with some of them who are not who became friends. And I said, why is it that we don't see more of this being utilized? Why aren't you able to freely, I asked them, why don't you freely refer people to me? And they said, in all honesty, Ben, it does not fall within the paradigm of the standard of medicine. It's like typically if you have, once you start talking about dietary or nutritional supplementation, which remember their education is extremely limited with.
Yeah, they're not taught that.
Part of their profile. They won't listen to it. They don't want to look at it. It's like it used to crack me up. Okay, so here, don't you love this statement? Before you start any diet or weight loss program or anything of that nature, go speak to your physician. Okay, who doesn't have the education background and will not look at it because now they become responsible. And I've seen some of the reactions that people have. I've talked to them on the phone. He says, I can't look at it. You mean you can't look at it? This is your patient. We're co-treating the patient together. You don't understand. Once I look at it, now I'm responsible. And of course, there are issues with malpractice and what have you.
But that's amazing. So he won't take responsibility for like telling you to eat more cherries or to have like more green vegetables, whatever. But he has no problem prescribing a medicine that could potentially give you 10 different side effects, and cause death.
We're getting into very heavy territory right now. And the heavy territory, no, I'm serious, because the reality is that they are constrained in their, unless you're the extreme, basically means that you've gone to the holistic route. They clobber these poor practitioners. They literally scare the bejesus out of them. They threaten them. They'll take their license away. I mean, there's so many issues. I don't even,
that's a whole
different thing. And it's really sad.
Oh, yeah.
So it comes down to the individual person that has to seek another practitioner outside the realm of traditional medicine to help get the services that they may need to make their life better.
To be fair to doctors, we can't complain until there's tort reform. I mean, if they don't,
I agree with that 100% because I've become very friendly with a lot of these practitioners, and they just honest with me. He says, I can't risk it. And I said, I get it. I get it.
Right. But you know what? But the other things that I don't want to say I take issue with, but I notice when I talk to people, you'll talk to somebody who's complaining about something, and, I'll recommend, I know a ton of healers of every different modality or whatever, and they're not covered under insurance, a lot of them. And they'll be like, oh my God, that's, $150 or $200. And it's like a lot of money and it's not covered. And I'm like, so was like the concert tickets you bought covered under insurance? It's all about your priorities. And people are like, if it's not covered by my insurance, I'm not going to do it. I'm not going to spend my own money. All right, well then let your body, fall apart because you're drugging it and cutting it instead of trying to find source solutions. Who's the only one who pays for that ultimately? You.
You do, definitely. Look, money is only an issue in the absence of value. I always say that to people.
Totally.
You can go out and spend $5,000 on a leather bag, and you can buy another one made by an incredible craftsman for maybe $500, and that product's even better. But it doesn't say, the big names. So and you notice I'm specifically avoiding using names, mentioning things too, because I don't want it to come back and bite you in the tush for me or him.
Yeah, with you.
And that's the world we have to live in. So think of our brethren in medicine where they really want to help people. Okay. And it's fully demonstrated by them coming to see me, because I've had many of them, emergency room physicians, diabetic, hypertensive, sick, obese, things of that nature. And, as they say, they came to me, a chiropractor, once per the person considered to be the extreme worst of the healing profession, and the world changed dramatically. Look, we're living in very, very challenging times. And it's only going to get worse before it gets better. And that's when it really comes down to people are going to have to speak up their heart. They're going to have to really take a stand on different things and say, this is what I want for myself, and this is my life. This is what I want for my children, and these are the different things. And I always say, you don't throw the baby out with the bathwater. You utilize the practitioners of the more standard healthcare positions in medicine, obviously when appropriate, but start integrating the complementary aspect. That's why I say I take an issue with the aspect of being called an alternative practitioner. We're complementary. We work with the body, just as many of these other practitioners do, to help bring it to a different level of health. So,
well, the truth is, if it can't be patented, it's not considered official medicine because money can't be made off of it, unfortunately. So that's why.
And that's, my friend, you bring up a very important topic. There's no money to really be made in holistic medicine. You know that. When the average cost you enter the emergency room is $10,000 without blinking an eye, and people walk out and say, "What do they do for me? What happened there? Okay, they gave me a shot of Toradol for my pain, but that thing's going to work out within, it's going to be out of my system within the next day. I'm still dealing with something." So now they refer me to another doctor, and it's like, and they go through this medical, wheel that, like the hamster's wheel, over and over again until they start seeing it. And typically what happens is that people have positive experiences with the practitioner of another healing art, and they say, "My God, this person has helped me in so many different ways, saved me from surgery, healed my body, eradicated this thing." You know what? All healing comes from within. We are merely a tool to help that process, all of us, in everything that we do.
Well, and the other thing is that it's your responsibility. It's your body. And if you blindly place your entire body in the hands of another human being, knowing nothing, how responsible is that? Is that called adulting?
Yeah.
How is that adulting?
I'm telling you right now, unfortunately, the world in many, many situations have been programmed to do that. There's a lot of propaganda going on out there. Well, look, the things that you're doing, the journey that you've been on, the evolution of your life, and now being able to utilize that and help other people is a great thing. How can people get in touch with you?
So they can go to either my Facebook page is Christine Regan Lake, author, speaker. And if they want to look at my art, they can go to Christine Regan Lake Art on Instagram.
I think we're going to pass that information over to our great friend here, Mr. Greg, and he'll post that information so you can get some of it out there. And that way people can get in touch with you and make the kind of decision, that needs to be done.
Absolutely. And, we're coming close to the 40-minute mark. Zoom's
That's the reason why I tried to wrap it up, because I just said, 2 minutes.
Well, thank you so much, Christine. This has been a great discussion. I think, like you said, some of these subjects could be podcasts unto them, 4 or 5, 6 podcasts unto themselves. I'm sure we'd love to have you as a repeat guest to delve further into some of these topics. And
I'd love that.
Great.
She's a wealth of knowledge, and she's a wonderful person, great heart, great human being. And I don't say that lightly unless I know them. And that's what this is all about. So that's the reason why I said I wanted to bring you on board today, because I say you impress me all the time, like you did just recently. So, you know what?
Thank you. It was great to be here. I appreciate it.
Excellent.
Awesome.
Likewise. Thank you.
All right. Have a good night. Bye.